Now, let us move on to Module 6, which deals with Introduction to Home Care. The goals of this module are providing an overview on home care and why home care is important, introduces participants to the care plan and the important functions of observing, recording, and reporting, provide participants an overview of qualities of home care aids. It helps them begin to develop an awareness of and respect for the range of diversity in the clients with whom they will work, including but not limited to race, national origin, spiritual or religious beliefs, sexual orientation, and age. Now, what is home care? Home care means taking care of people in their homes. Usually, the home health aide works for a home care agency, and the agency assigns the worker to one or more clients. And what are workers called? Workers in home care are called home health aides, can be called home attendants or home care workers, can be personal care aides, attendants, or assistants, or personal care assistants, or direct support professionals, or in general, caregivers. And who are the clients of home care? The clients of home care are those people who are elderly and needing assistance. These are the people who are sick or disabled for the rest of their lives. These are people who are sick or hurt and are recovering at home. Or these people who are dying and want to remain at home. And why is home care becoming more important and more in demand? There is a high growing number of elders and disabled in the United States, and they want to stay in their own homes. Nowadays, hospitals are releasing patients sooner than they used to. And in general, family and friends cannot give these people all the care they need. And home health aide or caregivers may give comfort and companionship in the home, assistance with activities of daily living in the home. They may give assistance with cooking, cleaning, laundry, shopping, and getting to appointments. And there might be specific health-related tasks that are assigned in the care plan. And what is consumer-directed care? In consumer-directed care, the client is called a consumer. He or she lives at home or in an assisted living facility, and he is in charge of his or her own care. And the consumer often hires and supervises the home health aide. And the consumers are usually able to manage their own care. They are adults who have recently been disabled. And they are adults maybe who have disability from birth. And they may have trouble doing daily tasks. And what are the types of support that home health aide gives? They may assist in the field of personal care, daily tasks, going to work, appointments, or community activities. Now, you are seeing here a care plan or service plan. A care plan or service plan It describes all the tasks that a home health aide or a caregiver is expected to do with the client. If a task is not on the care plan, the caregiver or the home health aide is not supposed to do it. In the care plan or service plan, the following important information should be indicated. First, it has to have client's name and address, a signature of the client or someone representing them, the agency providing care or services, or the person who wrote the care plan and that person's signature, the type of worker that is required for each task, and it has to have the date that the plan was written and the date when care should start. Now, let's talk about types of tasks, including how often they should be done and if there are any special instructions. In personal care, it deals all about bathing, dressing, or using the toilet. They may have tasks in assistance with activities or exercises. This means how to get around or transfers if needed. It can be care of the home or non-personal care. That includes cleaning, shopping, going with client to appointments. Or there may be some tasks that are about treatments or health-related tasks. And these are all about assisting in changing bandages, measuring food input and waste output, and assistance with medications. And there may be a task that are food-related instructions that includes about diet, client's meal preparation, or assisting with eating. Now, the skill of observing, recording, and reporting is very, very important skill for home caregiver. You have to know what are the things that you should observe and what you should record and what you should report. When working with a client, a caregiver can notice changes in client's condition. You have to observe. Sometimes these changes need to be written down or recorded and or shared with the supervisor, care coordinator, or a nurse. You have to report. In some cases, the caregiver also needs to record when a task is completed with the client. You have to report changes in the client's condition, physically, mentally, and emotionally. Changes in the environment or setting that you know could affect the client's health. You have to observe, record, and report changes in relationships with family and friends that could affect the client's health. In client's condition, you have to look for the following: signs of physical discomfort, changes in what the client can do, and changes in client's behavior. And of course, changes in physical appearance. In client's environment, you have to look for potential safety hazards or health hazards. Record or report client's relationship with family and friends. Look for family or friends who used to visit regularly and don't anymore. Family or friends who suddenly start visiting regularly. And how do you record? And what you should write. Different agencies have different forms that they want to use for recording, but you have to be objective as a caregiver or home health aid worker. It means that don't try to figure out what something is happening or why something is happening. Write only what you see, write only what you hear, what you smell, or what you feel by touch. Write what the client does and what you do. You have to put a date on all of your observations and don't forget to sign your name. Now, let's go to knowledge. Knowledge is one of the things that make you as a caregiver really good. Knowledge describes the information and processes that a home health aide needs to understand in order to assist clients. Assisting clients in their daily living activities, knowing common diseases and problems of the human body, knowing and knowledge about emergencies, knowledge about healthy foods, and knowing the signs of abuse and neglect and what to do about them. Now, to make a good caregiver also, you have to be competent or skillful. Skills refer to being able to do certain tasks well. In home care, that means being able to help the client do ideals gently, effectively, and without either the client or the caregiver getting hurt. Skills also refer to communicating and helping with problem solving. It also deals with being skillful keeping germs from spreading. And to be a good home caregiver, you have to possess attitude. And attitude mean these are the personal and emotional qualities that a home health aide brings to his or her work. Attitudes are shown in the way the caregiver acts toward the client, coworkers, and supervisors, and the pride he or she takes in doing a good job. Having a good attitude, she's able to share personal information only with members of clients' healthcare team. She gives clients privacy. She tells the truth, or she works well with other people. Let's talk a little bit about, again, about diversity. Diversity are the differences that you find in any group of people. Some of these differences are about race, language, age, sexual orientation, religion, culture, and abilities. These are the things that could affect an individual. It includes communication, beliefs about health and medication, food choices, housekeeping choices, family relations, friends, and family networks. People like to be treated with respect. You show respect to a client when you learn about the client's culture. Remember that the individual is unique. If you're confused about what the client means, ask. Think about what you say before you say it. and keep an open mind. It is important to be comfortable with diversity because in your job, you will work with many different types of people. Diversity can affect the care you provide to a client. We all make assumptions. This is a natural part of getting to know someone. But when we are helping clients, we need to be aware of our assumptions and always ask the client how they want to be helped. Respecting and valuing each person as an individual will help to overcome assumptions and stereotypes.